Hello. Sí, pero no sé cómo pasarlo. Ok, gracias. Quiero guantes. Los negros. So, hello everybody. Good day, good morning, good afternoon, good evening. It will depend where you are. So today I am with my fellow Daniela Tabachieli. Tabachilia. So Daniela is from Romania and doing is doing a fellowship with me. I am very honored to be with her. So now, so today we have a very interesting case, and we have a lot of things to discuss. And this is very important. This is why we have this live endoscopy channel. Quiero una bata. Tabachilia. So Daniela, so I will explain a little bit this case today. So we have a patient, 66 years old male, with history of fever, and with collection in the liver. So at CT scan, and as you can see here, at endoscopic ultrasound, I am with a linear scope. So this lesion is located in the segment 5 to 6. So just in the middle, okay? As you can see here. So the abscess is the most important. I know that it's as Daniela told me, it's really important to mention. Okay, it's really important to mention that normally it's a little bit difficult to perform some kind of drainage in these segments of the liver. But what I believe now is the location is easier to have this to perform this drainage. Okay, so first, because the location, I have the distance from the abscess to the wall, like 16 millimeter, 21 in this case. So I need to search for the smallest distance from this abscess. So my idea or my goal today is to perform a drainage to the stomach. Okay, so and I need to see where is the best window. The best windows to perform this drainage is the distance between the stomach wall and the liver. and for sure the abscess. Okay, so I need to measure well. Okay, so I have 16 millimeter few moments ago. Maybe here. Let me see. So I'm looking for the best triac, 70 millimeters. This is the best triac. This is the best way to go inside. But so I would like to say hello to Latin America, to my good friends. Me gustaría decir hola a mis amigos de Latinoamérica y gracias por seguirnos. Sobre todo a nuestros amigos de Venezuela, ¿ok? Que siempre nos escriben. So thank you so much for my Latin American followers and my especially my friends from Venezuela. Thank you. I hope to in the next time to visit Caracas. Dr. Batista, next time I will visit you because this time Juan Manuel wants to go there. So now I will use a needle because I need to pass through a guide wire to perform a well drainage. Okay, so necesito una aguja primero. ¿Qué pasó? No, no entendí qué cosa. Yes. So Daniela is saying to me that I need to explain that I am in the duodenal wall, in the duodenal lumen, so I am explaining now that I am in the duodenal lumen, okay? So I will try to use I will try to see here. Or maybe here. So I was explaining that I will that is very important to see the distance from the axis. Okay, so now I am inside the duodenal lumen and I am trying to see the best space or window to do this drainage. Okay, so this is very important. Second, I believe if I can try to use an axios, okay, in spite of the distance. I have 16 millimeters. Okay, so this is the best axis that I have. So you need to see the thickness that you have to pass, and you need to search the small thickness area. This is very important. Second, you need to see if there is any blood vessel inside, because this is important. So my goal today is to try to have an access here and to have a good drainage. Okay, so this is the position that I will use because of the distance. Okay, from the lumen. Okay, this is good. Now, I will use a 19 gauge needle and I will pass a guide wire. So now you see, I am very well. I do an aspiration and I have this. So now, no, necesito la guía. I will flush with saline solution, it's okay. It's going down. and I will pass the guide wire at 0.035. So I am here. Okay, so I am inside now. So I will pull back my needle and I will use a 15 millimeter of diameter of hot axis. Okay. So now I think you can see better. So I am pull back my needle and my technician is pushing the guide wire. So this is very important, okay? Okay, so now so you can see here, this is the collection, this is the lever, this is segment 5, this is segment 6 a little bit. So it's near to the segment, between the segment 5 and 6. But in this patient, the window is not too bad. So now, I am using a 50 millimeter axios because the idea is to go inside after and perform so now I am very good here. I am inside, you can see, you see. So I push a little bit my scope because I need to open. So the normal indication is to have 1 centimeter between the, this part of the axios. I don't know if you can see in the camera, but in this case you need to go through the end and open through the end first, okay? I am starting to open now, and I need to push a little bit. You see? Very well. So now I open. And I am inside the collection, okay? So I will try to push a little bit more. I am very well, huh? And now, as you can see here, I am pushing. I am very well. Look. So I have here, this is the collection. This is the axios, very well open. And now I am very well. Now I need to pull back. Without losing the axios. I starting to open in my scope, and I see the opening in the lumen very well. So you can see here both lamps open. Okay, so Daniela is happy, huh? So it's okay. So now I will go out and I will less, yes, I will less the axios inside, and I need to pass a balloon dilation. I need to delay. ¿Cuánto tiene dilatación? No, no, quiero saber cuánto el axios. No. Gracias. Yes. So I need a 50 millimeter balloon, okay? So I don't know if we have the scope image. ¿Podemos ver la imagen endoscópica, por favor, o no? So I start to see the axios. So the pus is coming, as Daniela says. Okay, empuja. And now I will open more, and then I will pass a scope inside, a standard gastroscope, and I will clean. So the patient will recover faster, in less than 24 hours. Okay, this is one of the advantage to perform a good drainage. How long you have to last this? I believe at least 15 days, and to perform a new CT scan, okay? So now I am taking off my axios, and I will pass balloon dilation from microtech. That's correct. This is the length, you know. So it's a 50 millimeter. It's 12. ¿Cuánto mide? 12. 12 to 15. It's okay for microtech. That's correct. Oh, it's a nice product. Very nice product. So this is very important. The material that you will use, and these have 3 centimeters of length. No, ¿cuánto tiene de largo? 5 centimeters of length. So as you can see, la imagen ecográfica, por favor. So the axios is well placed. And now I have my balloon going inside. Okay, puedes dilatar. So you can see the distal part of the balloon. The axios will open. Hasta 15. So now you can see the opening of the axios with the balloon here. Very well. So we open until 15, and now picture. Okay. Okay, desinfla. And now I will do like normal pseudocyst drainage. I will go inside, I will do an aspiration, complete aspiration, and then I will clean with saline solution, okay? This is one of the advantage to do a drainage by EUS. I always say that sometimes we believe that it's not possible to do it something, but not this because just it's I think you need to see the window. The window is the most important. That's why all the drainage of the biliary tract, let's say, it will depend on the window, okay? So I will change the scope now, okay? So I will retire my scope. You see the pus going out. So now the key points. This is a liver abscess, and we are doing a drainage of this abscess, this collection, this fluid collection. So this is an Amebian abscess of the liver, and we're located between the segment 5 and segment 6. So in spite to be in this segment, we arrived to do the drainage because of the window of this patient give us the access. Okay, so I put an axios of 15 millimeter of diameter because I need to go inside, and the idea is to go inside. If you want, you can put also one of 10 millimeter. Why 15 days? Because we need to wait for the fistula perform mature. So now we need to wait regarding my technician, so you will see my face. I'm sorry, this is not good. So you see the axios is well placed. So I'm doing a big aspiration now, and I am washing. It's very good. So all the collection is going out. So this patient will recover fast, and he will not take, you don't have to need this patient inside the hospital. So you will decrease and improve. You will decrease the hospitalization of this patient, and you will improve the economies also. So I think one of the big advantage of lamps today is that we can drain a lot of collections. There is a lot of publications regarding this worldwide, and not just for pseudocyst drainage, it's for fluid collections everywhere. So now I am trying to go inside the lamps. You can see here. And I will have, you see here, this is the, it's a lot of, puedes tenerme aquí. So I will try to go inside. Oh, it's not easier, but it's not impossible. So we will see the collection. We are seeing the collection inside the liver. What we'll do after, okay, when we finish and this patient becomes normal, the laboratory data and the CT scan, we will remove the axios, and then we will close with an over the scope clip with an Ovesco, and this is finished, okay? So I will cut my transmission. Thank you so much for your attention. I am very happy to show you this case today. We have always very nice case, but I try to show different case or different situations that we are doing here. So thank you so much. Gracias por la atención. Un beso a toda Latinoamérica. Gracias. Chao, chao.